Well, Mr. President, sitting here listening to the senator from Arizona and the senator from Oklahoma go on, I hardly know where to start. There's been so many accusations and so much misinformation, it's hard to know where to begin. I would begin by, first of all, saying that the people that keep saying that we're slashing Medicare and that we're going to harm seniors is just totally false. The fact is, the bill that we have before us protects Medicare's guaranteed benefits, reduces premiums and co-pays for seniors, ensures that seniors can keep their own doctors, ensures Medicare will not go broke in 8 years by stopping the waste, fraud, and abuse. And I might also just say as an aside, every time I hear the senator from Oklahoma talking about waste and abuse and fraud in Medicare, it sounds like it's all in Medicare. Mr. President, the waste, fraud, and abuse we're talking about are the rip-offs of Medicare by pharmaceutical companies, many of whom have been fined big fines and settled. One of the most recent ones, I think, was like for almost $1 billion some dollars, one of the largest settlements in our history from a pharmaceutical company that was caught ripping off Medicare, from insurance companies ripping off Medicare, and others. It's not within Medicare, it's those that are coming at Medicare and trying to plunder it. But that's what we do in this bill. We're stopping that kind of waste and abuse against Medicare, not in Medicare, but against Medicare. We provide new preventative and wellness benefits for seniors. We lower prescription drug costs, keep seniors in their own homes and not nursing homes with the CLASS Act and the Community Choice Act that's also in this bill. When they talk about going after Medicare, boy, talk about crocodile tears. Was it not Newt Gingrich, the former Speaker of the House, leader of the Republican Revolution, that said he wanted Medicare to, quote, wither on the vine? Was it not Senator Bob Dole, their standard bearer for president in the 90s, who said he had fought against Medicare and was proud he voted against it? Now, all of a sudden, it seems like Republicans are the guardians of Medicare. People know the truth, Mr. President. American people know the truth. They know it's the Democrats who fought for Medicare. Lyndon Johnson and the Democrats, Lyndon Johnson is president, and the Democrats in the House and the Senate. If it weren't for them, Medicare would never have been passed. It's Democrats who have fought to keep Medicare alive and well and healthy and expanding it to people all over this country, every step of the way, being opposed by our friends on the other side of the aisle. And now to hear them talk about how much we're going after Medicare, boy, talk about crocodile tears. Well, the other thing I wanted to say, Mr. President, is I wanted to correct something that the senator from Oklahoma said. He talked about the recommendations that recently came out, and I'm going to have more to say about this in a minute, about the recommendations that came out on mammograms. And he said the United States Preventative Services Task Force, all they did was look at cost. That's what the senator said. They looked at cost, but they didn't look at the people. Well, Mr. President, recommendations that come from the United States Preventative Services Task Force cannot take into effect cost. Cost cannot be a factor. They can only look at scientific evidence, safety, and efficacy. Cost cannot be taken in as any factor in their deliberations. So I wanted to set the record correct on that. As I said, there were so many things I heard from the other side, it's hard to know where to start. I see my leader here, Senator Dodd, who did such a great job in getting our bill through the committee and getting it in the form that it is there and on the floor. I'd like to ask the senator. Senator, I know that you were here. We were both listening to our friend, the senator from Arizona, go on. Did it kind of strike you that what he said was kind of missing the mark a little bit here, and maybe not quite what we're doing in this bill? I asked my friend from.
Well, I thank my colleague, just to set the record, because it is amazing to me in a short amount of time how people can misconstrue events. First of all, to our friend from Oklahoma, talking about the Medicare Advantage bill. And he said, you know who sets the rates? The government sets the rates. Well, that's true. And that is because when that bill was passed, with very few people on this side supporting that bill, almost overwhelmingly on the other side, the requirement under the law, that passed, mandated under the law, that the private plans in Medicare be overpaid. And on average, those overpayments average 14%, in some states over 50%. The law that was passed here by the majority, and then running the place, insisted upon the mandates being included. So when you wonder why that occurs today, it's because they required it under law. Secondly, when you talk about the Deficit Reduction Act of 2005, again, maybe memories fade for some here. In fact, under that bill, children, working families lost insurance they had. The cuts occurred to proper screenings. Women lost access to mammographies. Cervical cancer screening was cut. Families lost these benefits. There were direct cuts in them here. The difference is today, what we're talking about, you don't cut these benefits at all. At all. In fact, we're increasing the opportunity for Medicare to be strengthened under this bill. There's a vast difference between what happened in 2005 and what's being supported today. And so I just want again, the record to be clear on this. You know, you can't make these things up as you go along. And that's what happened in 2005. It was an abomination and did great damage to people in this country. Today, people lost their insurance. Under our bill, 31 million Americans will have coverage. We now know the premiums are going to drop for 93% of all Americans. Premiums will actually come down. Individuals, small businesses, large employers, where 5 out of 6 people have their jobs. Those premiums come down for people. 31 million Americans will be covered under health insurance. Compare that, if you will, with 2005, when we actually cut mammography screening, cervical cancer research, assistance in health care for infants and children and women. That all got damaged in that year, not in this bill. That's the difference. And I thank my colleague for yielding.
The only thing I'd say to my friend from Connecticut said that we in 2005 had made all these cuts in the Deficit Reduction Act. I just want to say for the record, I didn't vote for it. And neither did the senator from Connecticut.
Absolutely not.
I mean, this was when, I would just say to my friend, was this not when the Republicans were in charge and they had a Republican president and a Republican House and the Senate? That's when they cut through all the cut on mammogram screenings and things like that.
That is true, and the record is very, very clear on it. It's not, people had the right to do so. That was their choice at the time. But to now try to write history somehow, that this wasn't, those cuts didn't occur, just the facts will prove otherwise. In fact, they did occur in these areas. And that's why there were those of us here who objected strongly at the time. My colleague from Arizona is absolutely correct when he says I said this was going to cut benefits for children and working families and cut screenings and tests for people. It did do that. Those of us who made those warnings on that day proved to be 100% accurate. And compare that, if you will, with what we're talking about here today, particularly with reducing costs, reducing premiums, and providing increased access for millions of Americans. That's the difference. Now, if you vote for the McCain Amendment, we're right back to where we were before. Right back. Which, of course, we all know means premium increases go up by literally 100% in the next 7 years. Tell that to the average family of 4 in my state. That's paying $12,000 right now will go to $24,000 in 7 years, as opposed to having those premiums be reduced, depending if you're an individual, small business, or large employer, by as much as 20%, 11%, or 3%. Not to imagine, to deny, of course, that you're going to also increase the number of people who would be covered under this. The present situation runs the risk of bringing our economy to its knees if we don't act. Recommitting this bill, going back, in a sense, would roll the clock back and do great damage, both to individuals and to our country economically. That vote in 2005 set us back terribly in this country. This proposal allows us to move forward and provide the coverage the kind of people need. I thank my colleague.
I thank my friend from Connecticut for pointing that out. I would just say, Mr. President, I have a letter dated December 1st, 2009 from the National Committee to Preserve Social Security and Medicare. And it says, Dear Senator, on behalf of the millions of members and supporters of the National Committee to Preserve Social Security and Medicare, I'm writing to express our opposition to the amendment offered by Senator McCain, which would recommit the bill to the Senate Finance Committee. Much of the rhetoric the President and CEO's letter goes on, much of the rhetoric from opponents of health care reform is intended to frighten our nation's seniors by persuading them that Medicare will be cut and their benefits reduced so that they too will oppose this legislation. The fact is that H.R. 3590, the Patient Protection and Affordable Care Act, the bill that we have before us, does not cut Medicare benefits. Rather, it includes provisions to ensure that seniors receive high-quality care and the best value for our Medicare dollars. This legislation makes important improvements to Medicare, which are intended to manage costs by improving the delivery of care and to eliminate wasteful spending. I won't go on and read all of it. It says, the National Committee urges you to oppose the motion to recommit the bill to the Finance Committee. Cordially, Barbara Kennelly, President and CEO. I ask unanimous consent this letter appear at this point in the record. But, Mr. President, I wanted to really talk about the amendment before us for a little bit. The amendment that was offered by the senator from Maryland, my colleague, Senator Mikulski. I'm going to have more to say about the bill and engaging perhaps with the senator from Arizona and Oklahoma in the days and weeks ahead on the structure of the bill itself. But I want to focus on the amendment that's now in front of us. First of all, I am proud that the bill, the Patient Protection and Affordable Care Act, makes significant investments in prevention and wellness, because I've long believed that such investments are essential for transforming our sick care system. That's what we have now, is a sick care system, transforming it into a true health care system, one that keeps Americans healthy in the first place, keeps them out of the hospital. It will keep a check on rising costs in both public and private health care markets. Now, it does this in a number of ways. I won't go into all of them, but among the most important is that this bill requires insurance companies to cover highly effective preventative services with no co-payments or deductibles. No co-payments or deductibles. Now, this is critical because we know that all too often people forego their yearly checkups or essential screenings, either because their insurance company doesn't cover them, or secondly, because they have high co-pays or deductibles that make them simply unaffordable. For example, I had a recent conversation with a small business owner in western Iowa. For he and his few employees, they have a $5,000 deductible. He recently turned age 50. His doctor said, time for you to get your first colonoscopy. Well, he went and found out that the colonoscopy was $3,000. He has a $5,000 deductible. This is all out of pocket for him. And so, not being a man of wealth and not a lot of means, trying to struggle to keep his small business afloat, he's putting it off. Putting it off. That's what's happening now. Well, what we say in our bill, these have to be covered without co-pays or deductibles. Now, there's been a lot of discussion recently on the coverage of preventative services for women in light of the recent recent recommendations issued by the United States Preventative Services Task Force on their mammogram screenings. Now, it's been alleged that the Reid bill, like the health and finance bills that preceded it, only requires coverage of those services strongly recommended by the Preventative Services Task Force. Now, this simply is not true. Under the language of this bill, health plans are required at a minimum, to provide coverage without cost for preventative services recommended by the Preventative Services Task Force. Understand that? It only says that health plans are required at a minimum to provide coverage at no cost for certain preventative services recommended by the Preventative Services Task Force. But these are simply the minimum level, not the maximum. The task force will establish the floor of covered preventative services, not the ceiling. No health plan will be prohibited from providing free coverage of a broader range of preventative services. And in many cases, the Secretary of Health and Human Services may well require that. That's because our bill gives the Secretary of Health and Human Services the authority to identify additional preventative services that will be part of the essential health benefits offered by health insurers on the exchange. The simple fact is, the Preventive Services Task Force cannot set federal policy, and they cannot deny coverage, period. Although there's been a lot of misinformation that has gone out about this. They simply give doctors and patients the best medical information, as I said earlier, not based on cost. Cost cannot be a factor. Based upon science and based upon efficacy and based upon outcomes and nothing else. Still, I share the concerns of some that the task force has not spent enough time studying preventive services that are unique to women. This was a concern that was raised when the Health Committee debated the bill in committee. At that time, I worked with the senator from Maryland, Senator Mikulski, to include language requiring that all health plans cover comprehensive women's preventative care and screenings based upon guidelines supported by what we call HRSA, the Health Resources and Services Administration. Again, with no co-pays, no deductibles. Well, that language was in our bill. It was not included in the merged bill. Senator Mikulski's amendment, which is now before us, which I've co-sponsored, would add that language like we had in our committee bill, and I strongly urge its adoption. Now, by voting for this amendment, which I understand we will do in a couple of hours, we can assure that all women will have access to the same baseline set of comprehensive preventative benefits that members of Congress and those in the Federal Employees Health Benefit Program currently enjoy. Let me repeat that. If you vote for the Mikulski Amendment, you will ensure that all women will have access to the same baseline set of preventative services that are enjoyed by members of Congress, women members of Congress, and all federal employees, all women federal employees in the Federal Employees Health Benefit Plan. That's what voting for the Mikulski Amendment will do. Expanding preventative health care is just one of the ways this bill benefits women. Again, our health care system is broken, it's expensive, and today less than half of women have access to employer-sponsored insurance coverage. Think about that. Less than half of the women in this country have access to employer-based insurance coverage. Now again, many of these women work for very small businesses. We know that. Very small, and they can't afford to provide that kind of insurance coverage. In most states, it's legal for insurance companies to charge women more than men for the same policy. Women can pay more than double than men do at the same age for the same coverage. Each year, thousands of women are denied coverage from health insurance companies for pre-existing conditions. In many states, a history of hospitalizations from domestic violence is considered a pre-existing condition. Think about that. A battered woman lives through domestic violence and now can't get health insurance coverage because of a pre-existing condition, being battered. That happens in many states. Now, with these options, it's not surprising that more than 16 million women are uninsured in this country. Women are often the healthcare decision makers in their families. They face difficult choices daily. 1/3 of women are forced to make trade-offs between basic necessities and health care. In 2009, more than 1/2 of women reported delaying care because of its high cost. Well, today, we have the opportunity to fix these problems. This historic legislation now before us increases access to affordable health insurance, ensures that women's coverage meets their health care needs. We will end premium discrimination against women. We'll end discrimination against those with pre-existing conditions. We will prohibit the rescission of health insurance coverage because of an illness. We'll provide more affordable insurance choices through the health insurance exchange, including a strong public option to increase competition and choice. We'll ensure that the policies that families buy are good enough. will require that all insurance policies sold in all markets provide adequate coverage for primary and preventative care for screenings, maternity services, and many other services that women and their families need to stay healthy. And as has been said so many times before, this bill will extend coverage to an additional 31 million Americans currently uninsured. As I said, 16 million women in America uninsured. And so that's why Senator Mikulski's amendment is so important, so vitally important. And that's why this bill is so vitally important. You know, we're going to talk a lot about Medicare. I see the Republicans are focusing on that, although the recent letter I just read to insert in the record from the National Committee to Preserve Social Security and Medicare says we ought to oppose the McCain amendment. So we'll hear a lot about that. But what about the women of this country and what's happening to them? The Mikulski amendment begins to address that in a very profound way, But then this bill takes it even a step further by making sure that women many of whom work for small businesses, who are sort of in an uncovered pool, so to speak, out there by themselves, now they can go on the exchange. Now they can get the kind of coverage that they need. They'll have the choices available to them, not just maybe one option, and in some states, no option. But they'll have different options available. And they'll be able to join with other like women around so that they'll have a bigger pool. And they'll have better coverage for themselves and their families. And so, yes, I can honestly say that the health care reform bill before us, the Patient Protection and Affordable Care Act, is a pro-woman bill. And it's not talked a lot about around here. But many of the things that are in this bill will go to ease the dilemma that so many women find themselves in this country. Providing the basic necessities for their children or trying to get health care coverage for themselves. And I can tell you so many women that I've met, that I've talked to, who have given up on buying health insurance for themselves so that they'll have enough money to feed and clothe their kids and send their kids to school. Women should not be forced to make that kind of a choice. This bill before us will enable women to not have to make that choice. They'll be able to get the insurance coverage they need at an affordable price with the tax credits that are in there for low-income women. And they'll be able to have the peace of mind of knowing that they and their kids are truly covered with the health insurance that they need. And so I will keep coming back to this time after time as we go through this bill. Two things: prevention and wellness, keeping people healthy in the first place. That's a big part of this bill. And if there's one thing, Mr. President, that's going to bend the cost curve, it's just that. Putting more focus up front on prevention, more focus on keeping people healthy in the first place. That's going to save us some money in the future. And the second theme I will keep coming back to is what this is going to do for the women of America. How it's going to help them and their families to have peace of mind and to have the health insurance coverage that they need. With that, Mr. President, I yield the floor.